As a graduate of Cranial 2, your next step is to sign up for SomatoEmotional Release 1. You may be wondering about that course and whether it's something that is going to be useful for you and also for your patients, and I can assure you that it is. Dr. Upledger named the course SomatoEmotional Release to distinguish it as a particular branch of craniosacral therapy that he developed from cranial osteopathy, so it has its little service mark after the name. But actually, it really also could be called CranioSacral 3, because it really is. All of the basic paradigms and principles that you've learned about in Cranial 1 and Cranial 2 flow into SomatoEmotional Release 1. The first 3 courses, including SomatoEmotional Release 1, actually form the basic foundation for all of the cranial work that comes afterwards. All of the branch classes, like the immune class and the pediatrics classes, the brain classes, and so on, all are based on the foundational skills that you learn in CranioSacral 1, CranioSacral 2, and SomatoEmotional Release 1. In Cranial 2, you learned about energy cysts and how energy cysts usually are the primary underlying lesions in the person's body. You also learned that there are 3 reasons why our bodies tend to form energy cysts. Remember, our bodies are self-healing, so if our bodies had all the resources that they needed in order to heal, they would have already done that. Very often, the limiting factors are the emotional imprints, unresolved emotions, unresolved tissue memory from trauma that are layered within these energy cysts. And we need more tools than we have so far in Cranial 1 and Cranial 2 to address those. So the 3 underlying causes, as you remember, are, first of all, the presence of previous injury to that particular area where the energy cyst is, and likely also the possibility of facilitated segments. The actual amount of force, the intensity of force that the body receives, either physical force or emotional force. And the third factor, though, was the presence of some underlying negative emotion or limiting emotion at the time of an accident or injury or trauma. And we find that that is very often true. This third factor is very often the most important reason why energy cysts and their imprints linger in the body until there are enough resources available to treat those. So in SomatoEmotional Release 1, you're going to learn new applications for the significance detector. You learned about the significance detector a little bit in Cranial 2, and what you learned is very useful, but it's just the tip of the iceberg, so to speak. There's a lot more that you're going to learn about the significance detector that is going to allow you to be able to follow the inner treatment plan of that person's inner wisdom to completion, to full healing of the energy cyst. We also learn about greater access to neutral on the part of the therapist, more refined touch and relationship between the therapist and the client. We also learn about the avenue of expression mouthwork, which is the second part of the mouthwork. You learned the first part in Cranial 2, but there is a second part, and when you put all those things together, it addresses a lot of physical structural problems, but also, as is indicated, the avenue of expression, which allows the client to verbalize sounds, ideas, thoughts, to allow images to come up into conscious awareness, healing images that are helpful for the resolution of these energy cysts, etc. We also learn the basics of therapeutic imagery and dialogue. And therapeutic imagery and dialogue is a tool that we have of working with these unresolved emotional imprints as they come up in session, as they are revealed by the inner wisdom. We don't go in fishing for them. We allow the inner treatment plan to show us when these things are appropriate to be dealt with. And therapeutic imagery and dialogue is just a tool that we use as therapists, just like all of our other tools and techniques. Useful when necessary. When it's not necessary, we don't use it. And just as with the other first courses, we talk about using the minimum amount of force. In terms of therapeutic imagery and dialogue, we're also using the minimum amount of dialogue. Just enough support, just enough information, just enough coming to conscious understanding to allow the full resolution of that energy cyst with all of its physical components, not just its emotional components.